Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Important tractions and its uses. So first we're looking at the gallows or the Bryan's traction. So gallows or the Bryan's traction. So here it's a type of a skin traction. So it is skin traction. And the use, what is the use? The use is it is the fracture of the shaft of the femur. So it is fracture of the shaft. So shaft of what? Shaft of the femur. And what is the age group? It is less than 2 years of age. Then we move on to the Perkins traction. So in the Perkins traction, the type of traction is skeletal, and the use of Perkins traction is to the fracture of the shaft of the femur. So fracture of the shaft, and this is of the femur, and this is mainly seen in the adults. Then we move on to the Russell traction. So what is happening in Russell traction? So in terms of Russell traction, the type, what is the type? The type is nothing but it is a skin traction. It is a skin traction, and the uses in terms of the trochanteric fractures. So it is seen in terms of the trochanteric fractures. Next we move on to the Dunlop. The Dunlop or the Smith traction. So under the Dunlop or the Smith traction, the type is it is a skeletal traction. This is a skeletal traction. And what is the use? The use is it is a supracondylar fracture of the humerus. It is a supracondylar fracture, and this will be of the humerus. Next, we move on to something known as the Buck's traction. So what is Buck's traction? So the Buck's traction, it is most common lower limb traction. It is most common lower limb traction. And what type of traction? It is a skin traction. It is skin traction, and the uses in terms of the femoral fractures. So it is used in terms of the femoral fractures, then even in terms of the acetabular. So in terms of the acetabular as well as the hip fractures. Then we move on to the Crutchfield traction. So in terms of the Crutchfield traction, the type is it is a skeletal traction. It is a skeletal. It is a skeletal traction. And what is the use? The use is in terms of the cervical spine injuries. So it is in terms of the cervical spine injuries. Then we move on to the head halter traction. So under the head halter traction, it is a type of the skin traction, as we discussed. It is a type of the skin traction, and the use of the head halter is the use of the cervical spine injuries. So it is seen in terms of the cervical spine injuries. Next we move on to the halopelvic traction. There is halopelvic traction. So halopelvic traction, the type is it is a skeletal traction. It is a skeletal traction, and the uses it is for scoliosis. To learn and grow daily like this, please do subscribe.